the language that we use, the messages that we are giving to society should be based on scientific facts rather than populist approaches. Because this outbreak showed us that we must increase the public trust and we must increase the trust to science, especially health sciences. And also, we should increase the trust to politicians because most of the countries right now, the country leaders are trying to make a balance between economic losses, health losses. So they need to run the economy, but they need to save the millions of people's lives. So it's a kind of balance that needs to be taken care of very seriously. It is really difficult to sometimes find the words, to explain those interventions. But there is no one magic way. But democratic country leaders are using more transparent languages. For example, when I look at the Norway, for example, Australia, New Zealand, those country leaders are really communicating very clearly in a basic manner by using very basic languages with the people, so people can easily understand. Clear language, communication, good transparent communication, basic messages are very, very important. We are not in a war right now. We are right now, it's a kind of consensus building are very important right now. And working very closely with the other groups, opposition leaders, institutions, and international cooperation. Those are the main things that we should be considering very seriously in terms of delivering best messages to those people. Again, plain speaking is very important right now, plain speaking.
You heard Dr. Adnan Kisa. He is Professor of Health Policy and Economics at Kristiania University College, School of Health Sciences. And my name is Arne Kramsvik.
Corona case has affected not only the healthcare system. Today, when you look at the different economies of the world, especially if a country depends on service industry, these people cannot work. For example, look at the United States right now. More than 45 million people are unemployed. If you look at Europe compared to United States, people are unemployed, but when you look at the countries' healthcare financing systems, mostly depend on kind of welfare systems, we can say. And these welfare systems are making sure that these people are not widely affected by the impact of those problems created by coronavirus. So, as a health policy researcher, what I saw that if a country located in Europe compared to Africa, compared to Latin America, or compared to United States, I can say, they are acting more wisely to combat with these diseases. And decisions are only not made at the top level, but also many contributions in terms of decision making are coming from the ground as well. For example, look at Germany, look at Norway, for example, and other developed countries in Europe. The politicians are taking care of the decisions suggested by the scientists a lot. Especially there are some institutions, for example, in Germany, in Norway, for example, in UK. Those institutions are really leading institutions in terms of health policy making and conducting research. The results that produce from those institutions are taken into consideration by the policymakers a lot. So these are very important. So science works. If you look at, for example, Brazil, if you look at the Brazilian leaders at the beginning of the outbreak, they were really belittling the disease. This is the reality. Now, it is one of the fastest infected country in the world. If you look at the United States, at the beginning, the U.S. administrators were teasing with the disease. Right now, U.S. is the number one country in the world, has many cases and has many deaths Look at Russia, for example. Russia, the same thing. People are not really well educated. We call it health literacy. The health literacy rate of people in many countries are very low. So this is a kind of infectious disease. So compared to chronic diseases, that means you must focus on a lot, especially universal precautions. For example, social distancing, using masks, cleaning hands, and keeping virus away, and keeping yourself from the crowded places. Those are very basic things, but still very active, especially if you look at the other type of interventions. These are the public health interventions that are working very well. What we have learned as a kind of lesson, take-home lesson from this corona case, as a health policymaker and as a health scientist, still public health is a very important field. And we should invest a lot, especially public health interventions, vaccination, cleaning, sanitation, those kind of basic interventions. And these are little expenditures. You don't need to spend too much or large amount of money, but the impact or outputs that you see or results you see that get more, especially compared to investing in advanced treatment technology, high-tech hospitals, and etc. Second lesson that I can say, because public health is very important, having highly trained and well-educated healthcare professionals and health workforce is very important. You can have very strong armies, you can have high-tech weapons, but when you face with a kind of outbreak, what you see that in addition to good facilities, you must have a wonderful healthcare professionals. During this corona case, what we see that all healthcare professionals work in the hospitals, in primary healthcare facilities, or at any healthcare facility. They are sacrificing their lives to save millions of people. And many of the cases, what I see from the media or from the colleagues, they don't go their homes. They work almost 24 hours a day, 7 days a week. And their body, are not very strong because they are human beings and sometimes they are infected. So I heard some of my colleagues, for example, had diseases and a few of them died in different countries. And I think that they should receive one of the biggest awards in this world in 2020, 2021, because they are contributing to peace, they are making big contribution to health of the people in the world, and they are making big contribution to human beings to keep them healthy. So they deserve this. They are very devoted people. This is the second lesson, that we should have trained, highly qualified and also highly skilled healthcare professionals. Third one is a kind of take-home lesson, I can say, as a health policy scientist. Consensus is very important, because when I look at the management of outbreak in the world, what I see that if a country leader doesn't cooperate with the national institutions, they don't listen the voices of opposition parties or opponent institutions. These countries are having really serious problems right now. Because, for example, what I can say, one example from Turkey I can give. The Ministry of Health right now has a scientific board, and this scientific board doesn't have any representatives from the Turkish Medical Association and from the Turkish Public Health Experts Association. So most of the people in this board are having background in clinical sciences, and there is no scientists have background in public health and also in psychiatry, for example. I can say these are very important. So the reason why the government is not having Turkish Medical Association in the scientific board, because most of the members of those Turkish Medical Association and also Turkish Public Health Association are considered as a kind of left-wing supporters. So currently, right now, the right-wing government is administrating Turkish people. So they don't like to listen to the voices of the other people having different opinions. Same thing happening in United States. You can see that, for example, the current administration in the United States are blaming Democrats, and they are saying they did bad and bad, therefore we are having those problems. So blaming oppositions, blaming people have different views are not a kind of solution. So consensus is needed. The fourth take-home lesson, I can say, is all institutions in the education sector, for example, higher education and secondary education, even though at the elementary education level, should develop new teaching and learning techniques by using the digital technology. Because in many countries, what we see, for example, the universities are locked down. Some universities were ready to take care of this problem, but some universities were not really ready. So universities where you can see high-tech interventions in terms of teaching were really successful. But still, there are some students, some teachers, or some academicians don't know how to use high-tech. High-tech doesn't mean that it's a kind of effective way of teaching or effective way of learning, but we should find some kind of balance. So the pedagogy approach during the outbreaks, especially in this corona, because we are right now using home offices, home schools right now, are forcing us to develop basic, most cost-effective teaching and learning strategies for the higher education institutions and secondary and even the primary level education institutions. So investing technology is a kind of new direction right now, but it doesn't mean that we should invest for high-tech equipment, basic equipments. Basic devices are very cheap and more cost-effective. So as an academician, I must find out new digital teaching methods for my students. It doesn't mean that in-class education can be replaced with this new digital technology or with this e-learning technology. But we should have plan A, B, C, D, E, F, G, from A to Z actually, different type of interventions we should develop. I
think planning is a key here, because I think we have been fast learners both at universities and in health systems and politicians. We have all been fast learners in this situation. But I was wondering about the level of preparedness, because this is not the first time in history we have a pandemic.
Yeah.
So why is it that society is so low on preparedness?
Because when you look at the historical development of different outbreaks, Spanish flu is very famous, early 1900. In 80s, HIV/AIDS was very important. In year 2000, SARS and also MERS were very important viruses affected human beings. Because of the globalization and close collaborations with the countries and also flights, transportation, travels, what we see that there is no actually real borders of the countries, because from one country to another country you can see that this disease transmission is very high, and you can spread the diseases very easily, even though because a small part is can make a human being's life miserable. Why we are having this problem? Because when you look at the other outbreaks, this is the so far only infectious disease that we cannot control by using known medical treatment and vaccines. Therefore, we are not very sure about what kind of disease we are fighting. So we are very weak. This is the reality right now. And if you look at the research right now, it stayed longer and people have developed some kind of phobia, and it is called coronaphobia. And people are getting more and more depressive days and getting psychiatric problems right now, because they will lose their schooling, they will lose their job, they will lose family relations. And even though if you look at the countries used long-term curfews, for example, you can see that domestic violence and also divorce rates are going up. And if you look at the other side effects or negative effects of the disease, right now the known methods are not working. This is the problem. And uncertainty makes people more crazy. And therefore, international collaboration and also sharing the common interventions among the countries are very important. But still, it affects economy, culture, health, education. All sectors are greatly affected. So people cannot stay at home. So if you are developing plans in the long run to keep people at home, this is very, very serious problem, because actually in the modern life we don't stay at home a lot. This is the reality. We need to go for shopping, go for movie theaters, go for social activities, even though you cannot find enough space to exercise. You look at the fitness centers are shut down, and you can, if you want to go to shopping centers, limited amount of people are allowed to go in. So the problem is the uncertainty, because when you look at the explanations made by the researchers and also country leaders, even though they are providing some kind of hope for the future, they say in 2 years we will really know how we will deal with this disease. This is the reality. 6 months passed, and during the last 3 months, all countries are taking very serious actions. People cannot travel, cannot go to school, cannot work, cannot cooperate. For example, we are in a holy month of Ramadan right now in the whole country, and the religious leaders are saying that don't go and visit your elders and don't go and visit your relatives, even though it affected the religious life of the people in the world. You cannot go, even though if you need a kind of spiritual, for example, support, you cannot go to mosques, churches, or synagogues for praying. So everything is all aspects of life has been affected by this disease. This is the reality. Uncertainty makes us unhappy.
Based on this experience we are now facing for the next months, maybe years, I guess we have an expectation that this will change health policy. But if we want to be realistic, how do you think it will go to change health policy around the world?
Health policies right now should focus on more public health interventions and investing a lot, especially in school health systems. For example, what we see that we should be teaching more and more how to become a healthy person. Health literacy level sometimes doesn't depend on the education level of the people. It's a kind of awareness. It's a kind of creating knowledge and informing people. When I use my knowledge, experience, and education, still I can say that public health is very important, and investing people is the key actually to get rid of the side effects of those kind of infectious diseases.